Many people ask, what's the difference between receiving treatment here in the United States versus going to Mexico or Panama or other countries? There's a big difference, and that's because in the United States, the FDA says you can't induce these stem cells to start regenerating outside of the body and then give expanded or cloned cells up into a person. But that's because there's a potential or theoretical risk, is if you give cells some type of treatment to make them divide, that there might be some type of malignant transformation, and then you'll be putting malignant cells inside, somebody else's body. So in the United States, we can only take, whole umbilical cord blood or umbilical cord tissue and then transfuse it untouched. Whereas in Mexico or in Panama, they can take that umbilical cord blood, they can extract the mesenchymal stem cell, and they think the mesenchymal stem cell is the most important stem cell for neural restoration. Expand it up, divide it 100,000 to 1,000,000 times, and then put a lot more into your child's body. And that sounds good, and it may be good because the studies have never been done looking at expanded cells versus non-expanded cells. But the way these cells work is once they get into your body, they have the ability to read these inflammatory signals in the body and home in, kind of the heat-seeking missile to the areas of inflammation, whether it's the brain, the gut, or some other areas. I do believe the mesenchymal stem cell is one component of umbilical cord blood, and I do believe that might be doing the heavy lifting when it comes to autism. However, it's like chicken soup for healing. And kids with autism have been shown to have gut problems. They have problems with something called hunter-killer cells and a lot of other peripheral immune issues as opposed to central immune issues, which is in the brain. And that umbilical cord blood has hunter-killer cells, T regulatory cells, and hematopoietic stem cells, all of which have been shown to be beneficial, which you might miss if all you're getting are mesenchymal stem cells.